So why am I on hormone replacement and still have vaginal dryness? Well, that's what we're going to talk about today is how hormones affect sexual function for women. So welcome back to the channel. It's Dr. Durst, and I have my co-host with me today.
Hey guys, Farideh Golombieski, family nurse practitioner here at Revitalize MD.
So this will be a fun one because this is something that we actually discuss with our patients on a daily basis.
It's something we hear, it's something we see, it's something we treat. So this is fun for us.
Yeah. And so I was recently asked, I was actually on another podcast and they were asking about intakes for our women in sexual wellness or just sexual wellness in general, if we had questions on them. And so I said, since the very beginning of opening, we have had questions about sex on our intake forms. So it is a normal part of our intake that we don't just go over past medical history, their meds, their surgeries, their allergies, all of that fun stuff. But we also have questions that ask, how is your sex drive? Why do you want to have sex? Is this because of obligation? You
Or is it
want to have it,
fun?
yeah, or is it fun? Like, because sometimes you'll see that opens a conversation about how that's changed for a woman, but also, what kind of orgasms, internal, like, clitoral,
Clitoral
vaginal,
G-spot.
yeah,
Are you able to have an orgasm? Do you have difficulty having an orgasm?
has arousal change, incontinence, all of those things that are related to more of a functional, change that a woman might notice as they get older. And so no one asks those
No.
questions.
And then we also ask, is this something you've discussed with other providers?
Yes. And have they offered any solutions?
That's huge.
And it is, because there's almost a yes to all of that.
Yeah.
And there's almost a no to the second one, where have they offered you any solutions? So they bring it up. But also, I would say for me, about 100%, if not like really close, but like near 100% will say that they were never asked about sex by their primary doctors, and that if the conversation was brought up, it was by them.
Yes.
And would you say the same? Because
Yep.
we see patients all day. Like, again, not
We don't
every,
just do a
yeah,
podcast. We
yeah,
actually have
yeah.
an active practice where we're seeing patients on a daily basis.
And so we are seeing them separate. So when I ask, again, it's Farideh, the patients that you're seeing, we're getting the same responses for the most part. And so we have always asked intake questions. And again, if somebody kind of complains because they come to us for something that might not be related to sex, we're just very comprehensive in how we address it. If they feel uncomfortable, we can have that conversation. We sit down, and they just don't answer it. And then they end up telling us that, and we open the conversation when we're in person. So it is important. And so what we're going to talk about is vaginal dryness is just one part of it. But when you look at female sexual dysfunction, which again is approximately approaching about 50% of women, and even higher than that once they hit menopause, that they have more female sexual dysfunction. But that involves sex drive, it involves arousal, orgasmic strength, and pain. And sometimes vaginal dryness is what leads to pain. But vaginal dryness is something that would interfere with somebody's sexual satisfaction. So, and when we're talking about today, we're going to talk about vaginal dryness, because frequently women will say, why do I still have vaginal dryness? Just know that that's just one part of female sexual changes that can happen. So any are on estrogen, maybe even testosterone, and they're still having vaginal dryness. So
we didn't get there overnight, right? So we can't fix tissue overnight. This is really a tissue health issue. And the vaginal canal, vaginal tissue is very estrogen loving.
Yes.
So in the absence of estrogen, you can see a lot of atrophy and change into that tissue.
Yeah. And I will say that, so the entire female sex system, like, again, starting externally and going internally, is androgen dominant on the outside. So landing zone, the vulva, the labia minora majora, the clitoris. And then also estrogen, but more so androgen. And then as you hit the vaginal canal, it's more estrogen, but
Yeah.
still some androgen and highly responsive to estrogen.
Yes.
And so your cell has to be healthy and optimized. And so if you don't have estrogen, vaginal dryness is a consequence for sure. And so
So good labs don't
Mhm.
necessarily translate to good vaginal tissue.
Correct.
So you can be optimized in estrogen, but if we're not getting what we need locally to the vaginal tissue, we can still have dryness or pain with intercourse or UTIs or all the things that can come along with poor tissue health.
Yeah. And so having the cell healthy, and again, vaginal, like estrogen is a level we can follow to get to preventative level. But what Faraday is saying, if it's not there, then why would we not have improvement? And sometimes it's because, again, that tissue has progressed beyond just a hormonal responsiveness. And so it's local, and regeneration sometimes is necessary for that. You can add on. So again, estrogen, the two main symptoms that we're trying to optimize, perimenopause is that 40 to 55, 10-year period where your hormones are all over the place. Estrogen is still being made, but it's all over the place and fluctuant. Progesterone and testosterone drop. So optimizing those in that perimenopause. Once you hit menopause, that's an estrogen, you're no longer making it, but prior to, right before you enter menopause, you're actually making a lot less of it. And so optimizing that, vaginal dryness and hot flashes are the two symptoms that patients are most frequently going to see as a result of estrogen decline.
Yeah.
And I think hot flashes are transient. Some women don't have them, but vaginal dryness will continue to persist and get worse if not treated. So the further out we are, the more severe it was. Maybe estrogen optimization still isn't going to help.
Absolutely. I tell women all the time, you should not feel your vagina.
No, you should not be walking around thinking about your vagina.
We should not.
No, just like your elbow. Like you don't walk around thinking about your elbow.
That's it.
And so like you should not do that with the vagina. It becomes very distracting, and women think about it because it hurts.
It hurts
And
when you walk
yes.
with underwear, jeans. I mean, it can get very severe. So where hormones do help levels, we may need a little bit more extra help with the tissue.
And just know that, again, we see breast cancer, history. We see patients that are also want to prevent, breast cancer and have had a diagnosis. And it's not as if you can't treat those patients, even with hormones, but you have to evaluate that patient independently, decide what's right for them, look at levels, but know that even if we're not using estrogen, systemically for a patient, you can still use a vaginal estrogen prep, and even with other ingredients that help with vaginal dryness.
Yes.
So even a breast cancer survivor can still have
Get
estrogen
relief.
vaginally and get relief. And then if it's estrogen vaginally, like E3, for instance, there's 3 types of estrogen. E1 we don't use. E2 is the main one we're replacing to optimize into preventative levels. And then E3 is the third one. E3 is an end estrogen. It isn't absorbed. So if you use that vaginally, it's not absorbed, doesn't convert back to anything because it's the final product and it's great for vaginal health. So just know that vaginal E3 is something that women can use as breast cancer survivors to improve. Like Farideh said, you
Yep.
don't have to have vaginal dryness.
So with that, let's talk about systemic and local estrogen.
Yeah.
So, right, pellets, systemic.
Mm-hmm.
Perimenopause, we're already making it. It's already intrinsic to us versus local, like a cream.
Yes. Yeah. So basically,
or topically, vaginally.
If you're doing, number one, you don't need to replace estrogen systemically, E2 estradiol, during perimenopause. As they're getting close, again, if symptoms are there, it's just highly dependent on your provider and your patient. We're typically really using estrogen when we actually get a diagnosis of menopause that we can do by labs with estrogen and brain hormones. Prior to that, we're really not using a systemic estrogen for replacement. But a local one can be used like
Mhm.
E3 if you have vaginal dryness. And so,
Or
yeah,
even non-hormonal base. For some patients, it's appropriate where we're using like a hyaluronic acid base,
and like
which is
vitamins.
extremely
Yeah.
hydrophilic. So it can be very beneficial to bringing water molecules to the vaginal tissue to help with that dryness.
Yeah, no, absolutely is beneficial. And then that's where compounding pharmacies come into play because we've used compounding pharmacies for 20 years to fill the gap for the hormone system that was shut down from traditional medicine. And compounding pharmacies come up with some great products that you can use locally that don't involve
Yeah.
hormones. Yeah.
Or we'll have women that are on, let's say they're on pellet therapy and levels are fantastic preventative. We're at goal and they feel a million times better than when they first walked in the door, but they're still having a little bit of pain or a little bit of dryness with sex. And that way we can use an adjunct. We can add a cream like that, or even for a short amount of time, or we can do some rejuvenation treatments with lasers.
And we will get to the
Yeah.
rejuvenation at the end. But I would say that so when we're using estrogen replacement, so we are going to replace that estradiol systemically with a woman. So pellets, creams, patches, um, however that person is being optimized, that a lot of those women will improve with
Yes.
vaginal dryness because again the two main complaints are hot flashes, vaginal dryness. So if initially that vaginal dryness, a lot of patients get better.
Yep. I think it's like 75%
Yeah.
improve with just the dryness.
So vaginal treatment for preventative is quite effective. And then again, you can use an E3, DHA compounded products if you just find a provider. So the answer is find a provider that you trust, that know how to treat women that have some sort of what we call female sexual dysfunction. Those are changes that are interfering with your satisfaction for sex. And so estrogen works.
Yes.
But then if you already have a little progression, so they'll talk about GSM or genital urinary syndrome of menopause. When you start to develop that level of cellular change, you may not get an improvement with just estradiol. And
So
so,
that what we're talking about is thinning of the tissue,
mhm.
that severe, more progressed atrophy of the vaginal tissue, poor blood flow, which plays a huge role in the vaginal canal's lubrication.
Yes. And so once you have some cellular changes like that, because you've been without estrogen for a long period of time, because you just have tissue that responded faster to fluctuations in estrogen,
Yeah.
or maybe you have lower levels when you're dipping during that perimenopause. Whatever reason, if you have some cellular changes, you may not get improvement. And so that's what this video is about. Like,
Yeah.
so what happens when that happens? Well, now you know that there was some cellular changes that was beyond what the estrogen alone would repair if you're optimized by somebody that knows how to use estrogen to help.
Yeah. Even that loss of elasticity, that's another huge one.
Yeah.
So that's kind of what happens. So time makes a big difference. Women that are on hormones in perimenopause and transition to menopause, they can go right on
Yes.
estrogen and may not have any of these issues, where other women were seeing them pretty far out. They've waited quite a while or maybe never found solutions from primary or GYN. And by the time they're seeing us, it's everything hurts.
Correct. And so that just know that. So the other things that you would want to at least approach your provider about, and some of the things that you might be looking for to know that that provider is doing it well is like androgens matter. That tissue is also androgen responsive, which means testosterone. So testosterone is definitely a perimenopause hormone that drops, and so is progesterone. So those other hormones need to be taken into consideration. And are you being treated appropriately with that? And I would argue that if you are, then you're already on testosterone. You're probably not on a topical preparation of testosterone to get sustained levels and cellular improvement. But then again, those that still have any kind of changes such as vaginal dryness, then we need local tissue regeneration.
Yeah.
And so
And that can also look like recurring UTIs, burning, itching, pain
frequent.
with sex. Yep. decreased sensation. So it can look like a lot of things.
Yeah. So if anything is different to you, and it's still different despite the fact that maybe you overall feel great, that is when you need to start looking at regenerating local tissue, because we need to improve something else. And so, like Faraday said, it could be incontinence, it could be frequent urination, it could be that you have the feeling that you need to go, you have burning, because again, that just indicates that that tissue is not healthy.
And it's irritated.
Yeah. And so what we do in practice and what we love, and I don't think that there's enough of it out there. So I would highly recommend you subscribe, get more notifications of when we talk about this, but also share it with any women that you might know, because they need to know that you can do vaginal rejuvenation with lasers and with injectable regenerative procedures. And it's amazing. Transformative.
It's amazing.
Mm-hmm.
So we'll just talk about a couple that are tried and true. They've been around for a long time. We see great results with them. And the first one would be Votiva.
Yes. Yeah. And so again, a radio frequency modality. So there's going to be a laser we talk about, which is different than the laser you might have in mind, but also this is RF. So RF technology is there. And so Votiva is a radio frequency bipolar treatment that just surface heating the entire vaginal canal.
Yes.
And then we come outside to the labia minora, majora, the clitoris. And so you are heating the tissue to tell it it's injured so it repairs itself better.
How cool is that?
I know.
I mean, that's just so cool. And it doesn't hurt. There's very minimal downtime with this. This is a very comfortable treatment, and it can have such amazing results.
Yeah. And really any of the treatments that aren't having any penetration and don't have an ablative, and so Votiva doesn't, you really don't have any downtime if you don't want it, because it's just locally heating. And when we talk about any of these, regeneration means local heating, telling it it's injured to repair, is increased blood flow. That is lubrication, increased sensitivity, nerve regeneration, better orgasmic strength, arousal,
collagen production.
Yes, in support of the urethra, because it's also heating that tissue and collagen. So it's amazing. Any functional improvement can happen.
Yeah.
And so
then the next one.
Yes. Which one do
Same
you want to
platform, but MorpheusV.
Yes.
Right? So this is that need a little bit more. You know, with Votiva, maybe it's a little bit more mild to moderate, maybe not as much urinary incontinence, maybe not as much laxity, but then we have MorpheusV.
Yes.
So still radio frequency.
Still radio frequency, but microneedling. And so before you get all nervous with the radio frequency microneedling, because obviously when we have that done from an aesthetic standpoint and on skin, it tends to be a little painful. But I was super surprised when I went to train on this device and again, it was an advanced training on this device and these treatments. And I wasn't going to believe that it wasn't painful, because Morpheus on the face is one of my least favorite things to do, but it wasn't. Like, you do a topical, we have a special like product
mask.
that actually you mask.
It's kind of like a vaginal mask.
So you put the numbing, you do the vaginal mask, and you let them sit with that for a while with amazing treatment. Like, if anything, people might just, for the first couple times that we are actually pulsing, that just so they get used to the feeling. But I've had it done myself as well. Super comfortable and highly effective. And I will say that, like, all women love this treatment once they have it done for tightness, orgasmic strength, lubrication, vaginal dryness, again, incontinence control, orgasmic strength, everything. They really like it. And it is super comfortable. So that's radio frequency microneedling, driving the energy into microchannels. And then the Fotona. So the reason, and I don't even think I've talked to Farideh since I found this out. So Fotona is the laser vaginal rejuvenation. But when we were at a recent conference, that Cosmetic Gynecology Society, that it turns out that a lot of physicians think CO2 and ablation whenever they hear laser. And so,
but that's not true.
No, but they think it. And recently I had an aesthetic that was kind of the same thing, like laser is downtime. No, it's actually, it was another person that had sexual wellness procedures and didn't like the laser because it was an older laser with ablative, and downtime was too much for her. And I said, this is not the type of laser we're talking about. So
you can get amazing results without pain.
Yes. So this one, Fotona, is the laser in the Fotona Dynamis, and it has an internal GYN vaginal rejuvenating procedure. And again, it calls it lots of different
Yes.
names if somebody has prolapse that they're complaining of or incontinence, but the treatment that we do covers all of that. And prolapse is quite common in between pregnancies, period. Um, something I saw in almost every vaginal exam over 20 years in the ER. So this one actually does treat it, but it's not ablative. So we take
No.
the, again,
So
erbium
removing
mode.
skin. We're not removing layers and
None.
layers of skin.
You're just heating the tissue from the surface and telling it it's injured, just like Votiva, but that's radio frequency technology, and this is a laser. So we're using erbium, but with the Fotona, you can like manipulate the wavelength to do 170 different treatments, but also to just heat the tissue and to not ablate. And this is the only laser that has an erbium mode that can do that. And so, but amazing treatment. And then on the outside, likewise, we can take that same
Yes.
treatment and do an aesthetic, like tightening of the tissue.
A little vaginal facelift, if you will.
Yes. Yeah. And it's actually amazing as well. So the 4V is what we come to the outside and do. And just know that also we're heating the clitoris then. We're also, again, that's erectile tissue. The labia, the vulva is erectile tissue. So just improving blood flow. So just
So
know.
blood flow, collagen, mucosal lining. I mean, we're really helping that tissue improve with the support of estrogen. So I want to make sure that we reiterate that if you are in menopause and not on estrogen therapy and you do these treatments, it's not that you're not going to see results. You're just not going to see sustained results because you're not fixing the base reason of what's going on.
Yeah, hormone optimization being the key and the core.
Yes.
And again, if you can't have, you have a breast cancer history and you're afraid of that, again, see somebody that actually specializes it because you just have to do local that doesn't absorb
And you have to have the right
convert.
options.
Yeah, you have to be presented with the right information and to be given all the options. So that is what I would say. Number one, you need to have a comprehensive office that you trust. And just ladies, there are solutions out there. It has to be comprehensively addressed. And that's what we do at our office. And so again, if you're not getting answers, you can always reach out to us as well. But local regeneration, in addition to hormone optimization, does get 99% of women
Yeah.
improvement. And I think your sex can be the same at any age. It does not need to change when you are perimenopausal or menopausal.
Yeah. So there are solutions outside of estrogen, outside of prescription. So if you're on hormones, you're still having dryness, you're still having pain with sex, you're still having frequent UTIs, we will treat locally, obviously, but for remote patients, we can consult over the phone and you can come into Knoxville and we can put together a whole comprehensive plan for you.
Yes. Yeah. So, well, let us know if there's any questions. Let's start a conversation in the comments. Let us know when you're coming. Share it with
We'd
other.
love to see
Yes,
you.
we'd love to meet you in person and help you find solutions. But also, just share this with any women that you might know that are in perimenopause, menopause, and just need to know how to fix that. Any symptoms that they're having. Start comments. Let us know. Let us know what your experience has been with estrogen and approaching these kind of problems with your primary or your gynecologist, because and let us know if there's any other topics that you want to talk about, because we are willing to deep dive into anything. So thank you for watching.
Thank you.